It is estimated that only between 1 and 2 people per 1,000 are born deaf. But the chance of becoming deaf increases sharply as we grow older. Probably 3/4 of people over 70 years of age have some degree of deafness. This is brought about by one or more of a number of things that can prevent the proper passage of the sound signals through the ear to the brain. Problems in the outer or middle ear prevent proper conduction of the sound signals through the ear, so they cause what is known as conductive deafness. To start with, there could be an obstruction in the ear canal which may prevent at least some of the sound waves from reaching the eardrum. Such obstructions can be caused by wax or by a foreign body such as a bead. The next thing is the eardrum. If this is perforated, then it won't vibrate so effectively. It can become perforated as a result of pressure. This might come from the middle ear due to build-up of fluid in an infection, or from outside as the result of a very loud sound, such as an explosion. In the middle ear, several things can happen to inhibit transmission of the vibrations. For example, the eustachian tube can become blocked, which often happens during a common cold. This means that the pressure on either side of the eardrum may not be equal, which can prevent the eardrum from vibrating properly. Or there can be fluid or glue in what should be an air-filled cavity. This can be caused by infection. Sometimes the joints of the bones can become dislocated, or bone growth can fix the third little bone to the oval window so that it cannot vibrate. This problem is called otosclerosis. In conductive deafness, the sounds become muffled and fainter like this.
It was a long, low cottage with a hipped roof of thatch having dormer windows breaking up into the eave, a chimney in the middle and another at each end.
However, nowadays, conductive deafness can usually be cured by drugs or surgery, and hearing aids which amplify the sounds or bypass the obstruction with a bone vibrator pad can usually be very helpful. Deafness due to problems in the inner ear is known as sensorineural or nerve or perceptive deafness. This is because the brain is unable to perceive or understand the messages conducted through the ear. In the inner ear, some of the hair cells in the cochlea can be damaged, like those in these magnified photographs. Those at the base of the cochlea are most likely to be affected. This affects the ability to hear high-pitched sounds. Vowel sounds are low in pitch and quite loud, whilst many consonants are high-pitched and quieter, so are not heard so well. Unfortunately, the consonants are needed to make speech intelligible, as vowel sounds alone can give little more than the rhythm of speech. This is what it can sound like to someone who has mild sensorineural deafness without a hearing aid on.
Horizontally of enormous extent, though having no great pretensions to height.
A more severe loss may sound like this. So, in sensorineural deafness, in addition to some loss of volume, there's also distortion of the sounds heard. The whole message is not passed to the brain, so familiar sounds cannot be recognized, and some sounds cannot be heard at all. As a result, although increasing the volume of sound can help those with conductive deafness, it does not remedy the problem so well for those with a sensorineural loss. For them, it's rather like the effect of turning up a distorted radio signal. They just get a louder, distorted signal. This is why people who have sensorineural deafness do not get as much benefit from hearing aids as those with conductive deafness. Hearing aids work by increasing loudness, but they cannot make unclear sounds clear again. An added problem is that many people with sensorineural deafness suffer from something called recruitment. This means that a slight increase in sound volume appears to be a much larger increase and can be painful. Exposure to loud noises, infections such as meningitis, some drugs and other causes can lead to sensorineural deafness, However, the most common cause is the gradual degeneration of the hair cells in aging. In fact, the central nerve tissue starts to deteriorate soon after birth, although we do not notice the effect until much later. Unlike conductive deafness, sensorineural deafness cannot be cured, and it's less easily helped by a hearing aid. Unfortunately, sensorineural deafness is much more common than conductive deafness. Many of the problems which cause deafness can cause a mixture of sensorineural and conductive deafness. Hearing loss in old age is mainly sensorineural deafness, particularly affecting the ability to hear high-pitched sounds. This is why an older person can usually hear low-pitched sounds reasonably well, but not high-pitched ones. The resulting misunderstandings lead to some people mistakenly believing that the person is stupid or senile. Unfortunately, on top of the problems caused by not hearing properly, many deaf people also have to put up with a complaint known as tinnitus, causing noises in the head and ears. We'll learn more about tinnitus in the next part of the program.